Doula, 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 doula. This word is definitely becoming a household name. But even with all the growing popularity of the work, so many of us are not clear about what a doula actually is, and even furthermore, what isn't a doula. I think I first heard the term doula when I was a teenager, definitely as an adolescent, because I grew up in a community of chosen fam that consisted of a lot of different birth workers, from midwives, doulas, lactation consultants, and I remember hearing them talk about their work to one another. I remember hearing them explain what they did to other people. I'll get glimpses. And even still, I feel like even with wanting to be a doula, even feeling called to the work, it was vague to me about what a doula actually was. That part might have been more clear, but the what don't a doula do was definitely a lot more vague. So in this video, I want to talk about it. I hope that you walk away feeling very clear about the scope and the practice of a doula, as well as a little bit of context, a little bit of history, and a little bit more opportunity for you to have the self-inquiry that's necessary for you to figure out what does this work look like to you and what does it mean to you. So the first thing is, let's define the word doula. Honestly, the word doula was coined or given to this profession by a white woman after observing Indigenous people give birth in Guatemala. This is one of the oldest professions alongside the midwife. In fact, I like to think of the doula as the apprentice of the granny midwife. I like to think of the doula as the one that they can call on, the midwife. They knew that this person is going to slide through and they'll be able to support me. They'll be very good at it, and they know exactly how to support in holding that sacred space of the birthing ceremony or the abortion or postpartum time. I encourage you to find your own definition of a doula. You'll find yourself having to explain to a lot of people, honestly. My definition is a companion who supports someone who is pregnant, in labor, experiencing loss, or choosing to have an abortion, and the aftermath of all these experiences, better known as the postpartum period. A doula is not a midwife nor a doctor because the care that a doula gives is not clinical nor medical. The care that doulas give is all about deep listening, active listening. It's about advocating, educating, and showing up for their clients. So it looks different for each client, honestly, and looks different for each doula as well. Let's take a breather there. I really hope that you find your own definition. Now, as we keep going through, let's talk about first what a doula don't do. Yes, so some things that doula does not do. And let's just make this very clear, please, right now. Nothing medical, nothing clinical. That means no vitals, no vaginal exams, no assessing, the condition of the pregnant person or postpartum person, including the baby. So you wouldn't be weighing the baby, for instance, or giving medical advice. Doulas do not give medication unless in the explicit direction and supervision of a primary care provider like a midwife. For instance, if a client has a prescription for something and you hand that bottle of those pills to the client, that's okay. But you wouldn't be prescribing anybody anything, including herbs, okay? Unless you are an herbalist, right? Doulas do not make decisions for their clients. That should make you feel a lot more relaxed and at ease. I think so often we're nervous as doulas in the beginning because we feel this burden that we have to make these big choices. You're not making a choice for anyone. They're making their own decisions. Your only job as a doula is to give the information, give the resources, and just to be present. And then you just hold their hand, you hold space, you witness them making their own empowered choice. Trust me, you want it this way as well. How good does it feel for you to make your own choices for your life, for your body? It feels amazing, right? We want to invoke those same feelings in our clients. Doulas do not judge or project or insult their clients ever. Now, this is important because sometimes there may be disagreements, misunderstandings. And this is the type of profession where the client is always right. You want to be very mindful of how you're speaking about and to your clients, okay? We don't discriminate against others. Now, this may feel like a duh, but you may not notice that you're doing it. Using certain language that excludes other people, using different terms that most people can't relate to is excluding people. We want to be very mindful that you're thinking about all the different ways and all different people and all different places, all different settings, all different decisions that people who are pregnant or postpartum may make. Doulas do not provide services without explicit agreement to the terms and the conditions. This is really important because you may find yourself in these unspoken, unsigned, unwritten contracts with people. But you want to be really, really careful because if someone's calling you their doula, there should be an explicit agreement. It doesn't always have to be a written contract, but it definitely should be clarity there, okay? All right. Now, do we feel more clear about what doulas don't do? Let's move on to what doulas do. Doulas provide education so that our clients and loved ones are able to make their own informed decisions and choices. Doulas answer questions to bring more clarity for our clients to make informed choices. And we support people in all settings. That's home births, birth centers, hospitals, the forest, and the ocean and dolphins, wherever you may find yourself, right? Doulas do not discriminate against people's choices. Doulas offer support, period. We're just there to support. I like to often say that doulas are like the best friend without the drama, like the sugar in the milk. We provide our clients with resources, books and services, organizations that can support them. We provide a listening ear, but we are not therapists. So you want to just make sure that you're very clear if a client needs to just vent to you about something versus they really need to see a clinical practitioner to talk through some things and have the appropriate recommendations and tools afforded to them. We become very familiar with what is normal so that we can identify what isn't. Okay, so as you start to go to births more, you interact with more pregnant people, you support more folks in making the choice to have an abortion, you support more folks who are postpartum, you start to get pretty fluent about what is normal, so therefore you can support and be like, this doesn't really seem quite right to me. You might want to call a lactation consultant because your nipples should not be bleeding actually, right? It becomes common sense at some point. Doulas are not technically mandated reporters, but we do have a moral obligation to support our clients in being safe and well, okay? You may also find yourself cooking, doing some light cleaning, doing a couple chores and errands for people. Remember, emphasis on light. It shouldn't be that you are now their personal assistant or that you are their full-blown nanny if you're doing some child care, but maybe you're watching the child for an hour so they can finish and wrap up their, midwife appointment. That is totally in the spectrum. We show the family and support people how to show up for them in each part of the way. Okay, each part of their journey, each part of the path. This is really, really important because so often the partner, family, loved ones may not really know how to show up, how to support, and the doula supports in making that connection, which is everything for the pregnant person. Teaching the partner how to touch a pregnant body, how to touch a laboring body, what's essential, what's important in the postpartum time, what does a postpartum person need is so important. And this is why doulas make such a wonderful impact on the outcomes. Doulas answer their questions of their clients. If we don't know, we know where to get the answer. So for instance, when you first start your journey, you're going to learn from supporting people. You're going to learn about preeclampsia, you learn about low milk supply, all these different things will come up for your client, and by bearing witness, you eventually start to embody the knowledge and you can maybe share. But you may find yourself stopped in your tracks. I I don't know if this is normal. I don't know what to do for this. I don't know how to answer this text, this phone call, this question. All those things will happen. I guarantee you it will happen. It happens to me still sometimes too, because everybody is different. There's no way for you to know everything. But what's important is that you know where to find the answer. So a doula should be a well of resources. You start to know who are the lactation consultants in your community, who are the pediatricians, who are the doctors, the herbalists, the acupuncturists, the chiropractors, the pelvic floor therapists. And then that is a way for you to get the answer for your client or alongside your client. Doulas definitely are, like I said earlier, in the tradition of the midwife assistant. So you may find yourself naturally being drawn to the profession of midwifery. Just to rewind back to the don't section, if you are wanting to be a midwife, study to be a midwife. Don't try to do things that midwives do, right? But doulas are amazing assistants for the midwife, especially in the home birth setting. You may find yourself cleaning up for the midwife, handing them some new gloves, mixing up this or that or the third for them, getting some more towels. And this is also so helpful for the client for sure. I like to also think of doulas as master romancers, masters at connecting, masters at space holding, the resource plug, like I said earlier, that doulas can anticipate the needs of people easily, that doulas are amazing advocates. And not just advocates like you may imagine. No, she said she doesn't want that. They don't want you to do that. It doesn't look like that usually. It actually looks like reminding your client, are you sure you want that to happen? Remember we talked about delayed cord clamping? This is the time where you make that decision. Are you okay with doing it right now, or do you want to ask for a little more time? And then they use their voice and say, this is what I want. This is how I feel. This is how I want this to happen, right? And that is what the advocacy usually looks like for doulas. Doulas are also really good at upholding boundaries. But you have to uphold your own boundaries in order to uphold others people's boundaries, which is why, like I've told you all before, make sure you are practicing these things on yourself. Practice on yourself first. And therefore, you will mirror how to do that so easily and naturally and organically with your clients. Now that we're clear about what doulas don't do, what doulas do, I want to transition into certification. So there isn't a governing body for doulas, okay? Certification really is an arbitrary idea because, like I said, there's no governing body. There's no standard of care, scope of practice. There's no protection that's afforded each organization, each training institution. We're all just making our own criteria. Therefore, doulas cannot be licensed like a freelance artist, right? We're freestanding direct service providers, and it's unregulated. And there's some benefits to this because we're able to meet the gap of care that the heavily regulated and litigated medical industry leaves. We're able to meet people where they are, and we're able to cater to our clients so that it centers their needs. There's no agenda, there's no schedule, there's no shift that we have to come in and out of, right? We're just there for them. We do not have the burden of thinking about the legal consequences of our care, so therefore there's no incentive to try to change how we show up, right? If we are truly working in our scope of practice, that is. Let's emphasize that. You shouldn't ever be thinking about the legalities of something if you're working in your scope of practice as a doula because you're not doing anything medical or clinical. We can charge or not charge at our own discretion, and there's no requirements to support, so we can support our loved ones without obstacles, loopholes, or access holding us back. There are some disadvantages, however, for the whole idea of doulas not being regulated and not having a governing body, because if anything transpires without the supervision of a primary care provider present, then we may find ourselves in a compromising situation and there isn't a layer of protection for us. There's no governing body, right? We are contracted workers, And there are very few job opportunities that guarantee consistency and aren't contingent on us marketing ourselves and or word of mouth to build momentum, right? So therefore, you keep that guaranteed income coming in. It's very much so contingent on your connections and people just knowing that you exist. It's difficult to retrieve payment via insurance. It's not impossible. It's easier in some states than other states. But overall, it's not that easy of a process, even for licensed practitioners. So it's definitely some loopholes and obstacles that we experience as doulas. Because many people cannot afford doulas or haven't budgeted for a doula, this is pretty important. There is a lack of respect amongst certain communities and social, dynamics for the work that we do, especially amongst people who are more in the medical industrial complex. The nature of us being unregulated contributes to the ambiguity of the very important and sacred work that we do. I think because it is so versatile and it's fluid and it really caters case by case that it leaves people kind of confused about what we actually do. So, we are the ancestors of the traditional midwives. We're the descendants of the granny midwives, the village mamas, the aunties, the parteras, the healers, the medicine women, the root workers, the makers, the shakers, and the disruptors. We are the descendants of those who taught the doctors all that they know and then made laws and regulations that made it illegal almost or impossible for us to do our work. The concept of certification is honestly a very white, heteronormative, patriarchal, capitalist idea. A system to get more money. And it's a way to keep us from doing our work. It creates loopholes and obstacles and really makes it challenging for the common folk, the everyday folk, to do the work that we've always done, which is show up for one another. Because remember, there isn't a governing body or a standard for the scope of practice. Therefore, when an organization certifies you, it's arbitrary. It's arbitrary. It lacks merit. It's only relative to that organization or to anyone else who buys in to believing that and trusting that organization's standards, right? They asked you to read a book or two, attend a few births, observe or audit a childbirth education course, and then give them money each year or so, 2 years, 6 months, so that you can be certified. This is the oldest and first profession amongst humans. It's an organic and natural role to play in the community. Folks who are a part of the welcoming committee for spirit to usher in and exit this realm. No one can certify you but your ancestors. This is a calling. How can I certify you? How could so-and-so or so-and-so certify you? You're called to be a part of the welcoming committee to safeguard the vulnerable state that we are in when pregnant and no matter how it concludes. That's what it means to be a doula. That's what doulas do, and that's what doulas don't do.